All right, the first treatment we're going to show on this knee is an example of an acupuncture treatment we may perform for the knee pain. So this is just kind of for general knee pain. There's a few acupuncture spots that a lot of times will give you some relief, and sometimes we'll put just the needles in, and sometimes we'll do more of a dry needling thing where we'll run a little electricity through the needles and help that way. For this treatment, I'm just going to show you a couple spots that we sometimes perform the acupuncture on here. So I'll bring the camera a little bit closer here. So we kind of cleaned off the knee area there, and then we're just going to put a couple needles in a couple spots. It's called the eye of the knee. There's kind of two spots right above the knee, and just put a couple right there. And usually you can barely feel these. The needles are so skinny and tiny that you usually don't even feel it. And then there's a couple spots right below the kneecap here. And we'll do one more on this side. And so with acupuncture, they use the needles to stimulate chi, or you have these energy kind of meridians that run through your body, and if there's any dysfunction with that, it helps either unblock the chi or stimulate the chi to come to that area to just increase the healing, help with pain. And so that's an example of just kind of hitting the eyes of the knee here to help with the knee pain. If we were doing more of a dry needling session, if there was like a tight muscle, or we wanted to run a little electricity through, we have these things we'd kind of attach to the needles, and kind of like the electrical stimulation patches, we'd slowly turn it up, run the electricity through it, and could help with the knee pain as well. So there's a quick example of acupuncture treatment for your knee pain. Hi, it's Dr. Kowalski, and I'm just showing you another treatment we can perform to help with knee pain. So with this therapy and treatment is called a cold laser therapy. What we usually do is turn it on, get it going here, and we always want to make sure we put protective eye wear on to protect our eyes from the laser light. And so the way this works is it shines this laser light through any injured or damaged tissue, helps with pain, inflammation, also helps with just increasing the healing time. So if you have a sprained ligament, sprained muscle, any muscle, soft tissue stuff, it's just going to help that get rid of the inflammation and help with the overall pain. So I'll show you an example of this. When we turn it on, you'll hear that beep in the background. That means the laser is actually going. And a lot of times with knee pain, you'll have it kind of right on the front of the knee here, Osgood-Schlatter symptoms, or a lot of times it'll be on the lateral part where that IT band comes and attaches right through there. And those are two common spots we'll see with the knee, or if you have had a meniscus injury that's deep in there, this will help as well. So just helping all that inflammation get out of there, and then if there's any tissue damage with the muscles or ligaments, it's going to help it heal up faster as well. And what the patient's going to be feeling is just kind of a gentle warm heat. Feels usually really good. We got to keep the laser moving around, otherwise it will get a little bit too hot. That's why we got to manually move it around. And we usually perform this about 5-10 minutes at a time, usually around 10 minutes. And a lot of times we'll use it for ankle sprains as well. Anytime you have that swelling, inflammation, it's going to help the healing process and help that swelling go down. Especially if it's an acute new injury, we see really fast results. Usually, actually, by the end of the treatment, all that swelling will be reduced, usually about 50%. So one of the definitely go-to treatments when we're talking about different sports injuries, talking about knee pain, this is definitely one of the first treatments we will probably do when you come in the office to give you some fast, natural pain relief and to see some good results. So there's an example of laser treatment for your knee pain. Hi, Dr. Kowalski here, showing you another treatment that we do a lot on with knee pain. One thing we do, especially if you're a runner, playing different sports and you want to kind of give that knee some stability, or if you've had a previous knee injury, we'll put some Kinesio Tape on you before your marathon or your run or before your sporting activity. One thing I see a lot of is if your patella, sometimes it'll kind of slip out of its groove and usually gets pulled laterally because of some tight muscles or some dysfunction in the movement. So one thing I do a lot of is just kind of give that lateral kind of patella bone some stability here, so if you're running, it's not constantly kind of slipping out, along with some exercises to fix the problem. But there's one taping technique that we do a lot of, kind of that wraps right along the lateral side here. I'll show you here. With this Kinesio Tape, it's great because it has this flexibility and stretch in it, so it's not going to limit your movement, but it's going to give you some stability. So I'll have kind of the patient flex the knee up. We'll kind of follow it right on the lateral side, kind of pulling that kneecap back in just a little bit, all the way around here. And that way, when that runner or athlete's kind of moving and running, it's just giving that lateral support on that knee, so that patella isn't kind of flaring out on the lateral side of the knee there. So this is one example. There's a whole bunch of different ways we can tape up the knee, but this is one common tape that we do right through the lateral side. Usually the tape stays on 2 or 3 days. You can shower with it and everything. So yeah, definitely one thing we do a lot of taping is the knees, especially for all our running athletes. So just another example of a treatment we can help with your knee pain. So another treatment we can do when we're talking about knee pain is a lot of soft tissue work, whether it be ART or active release technique or myofascial release. We're just making sure all the ligaments, muscles that connect into the knee are moving well. So an example of that would be, say they have kind of knee pain right on the front of the knee here, right in that patella tendon area. So we might make sure we get all the tension out of there by gently putting it through this active range of motion while we stretch the knee out. So my thumb's kind of grabbing that tendon, holding that pressure while we put it through that range of motion, and that's gently kind of just stretching that front tendon out. And we can do this all along the knee. So if it's where that IT band kind of connects right out here, that's another common spot. You have a lot of muscles and ligaments and tendons all kind of connecting to that area. And you have a lot of nerves running right on the outside of that knee too. So we'll just kind of hold the outside of the knee, put that through the range of motion, and this just gently stretches all those ligaments and muscles out where they attach there. And we can do this all around the whole knee, just getting all that tension out of there. Really good, kind of one of my go-to soft tissue techniques is that myofascial release. Just a good way to stretch and get all that tension and pain out of there. So that's another example of a treatment we can do for your knee pain. And one more thing, when we're talking about the knee, you have a lot of these big muscles, your hamstrings, your calf muscles, that all kind of connect on the back side of the knee here. So like I said before, the ART or myofascial release works great on all these muscles. And so I was just going to show you kind of what it would look like on the back side of the knee. So we'd find the tight spots. So say the outside hamstring there is really tight. We just put that leg through a range of motion while we hold that muscle right here and gently stretch it out. We do this for a few minutes, a few passes, just gently stretching all those muscles on the back side there. And then same thing with the calf muscle coming up through here. We can kind of hold the muscle here while we go through this range of motion all up and down this calf muscle. When we're talking about the knee, you want to make sure all the muscles and ligaments that connect to it are moving well, get all the tension out of there, and that usually helps fix the knee problem. So there's an example of kind of working the back side of the leg. We do that for a few minutes, get everything moving well, get that tension out of there, and that will a lot of times help with your knee pain.